Tonight in Medical Rounds, it's an abnormal heart rhythm that affects millions of people. It's called atrial fibrillation, or AFib. As a matter of fact, the entire month of September is dedicated to raising awareness about this heart rhythm disturbance. And here to help us get the word out is Dr. Zweibel, Director of the Electrophysiology at Hartford Hospital. We thank you for joining us tonight, Dr. Zweibel. Nice to see you again.
Thank you, Denise. Thanks for having me.
Well, first, let's talk about exactly what AFib is, what the symptoms are, and why does it need to be treated?
Sure, Denise. Atrial fibrillation is one of the most common heart rhythm abnormalities that we see. It's an irregular beating of the upper chambers of the heart. Can lead to symptoms such as palpitations, lightheadedness, dizziness, shortness of breath, and chest pain. And it's important because it leads to about a 5-fold increase of stroke.
So that's why we need to diagnose it and treat it. And I understand Hartford Hospital has a multidisciplinary approach to treating patients with AFib. How does this benefit the patient?
Well, Denise, we've started off an atrial fibrillation center here at Hartford Hospital, which involves collaboration amongst many specialists involved in the treatment of atrial fibrillation. This includes cardiologists, which may diagnose atrial fibrillation and start the patients on blood thinners. It involves electrophysiologists, such as myself, who might treat the patients with a special procedure called an ablation procedure, where we put catheters inside the heart to burn away pieces of tissue that might be causing atrial fibrillation, as well as cardiothoracic surgeons who might do an ablation from the outside of the heart to help patients avoid atrial fibrillation.
So there's lots of interesting ways to treat this, and the point of our interview, I guess, Dr. Zweibel, you would agree, is that don't fool around with your ticker. If you think you have an arrhythmia, go get it checked. Thank you so much for joining us tonight, Dr. Zweibel. And if you'd like information on this, you can certainly head to our website, WFSB.com.